2026 Medicare You guide, now available, hot off the presses. You can get this. Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance, and this is the CB Health Insurance YouTube channel. Welcome. Today's video, we're going to talk about this guide, how you get it, what's in the guide, what's not in the guide, and when to look for it each year, and how you can obtain electronic copy from the government every year. Just sign up. If you're new to our channel, watching for the first time, please do not forget to subscribe, hit the little bell so you get notices when we release future videos, which is about every 2 weeks, although we might accelerate that during the annual open enrollment because there's a lot of information we want to send out. Don't forget to tell your family and friends, share the channel with anybody you know that is new to Medicare and confused. Give us a thumbs up and feel free to make a comment. Now, on to today's video, 2026 Medicare You guide. Today, as we sit here, it's actually September 11th. You know, we want to take a moment to say thank you for all those people that serve. This is a day we don't ever want to forget. But in September is when these documents are produced. CMS, Centers for Medicare and Medicaid Services, produces this document. It is so handy, and it's mailed out to every Medicare recipient every year in the month of September. Now, I happen to download it and I got a copy electronically, and we're going to talk about how you can get a copy electronically, but it's mailed out every year in September. Now, the thing that we are going to go over, and I did this last year and I'm going to do this every year, is the first page of this document is what's new. What's new for 2026? Then we're going to go over what are the other items that are listed in this, why this is important, because I understand Medicare recipients are inundated with mail, and you get another big document. This is 128 pages, and you go, oh my gosh, and you set it aside. But I want you to become familiar with this because it has a lot of very important information. And if anybody in your family is helping you with claims or anything, a son, a daughter, or you're helping a neighbor or somebody like this, this is a really good reference tool. So we're going to go over what's in here, what's not in here, and how you can get a copy. So let's start by, I'm going to scroll down to page number 2. Look at that. What's new? And so literally every year they list at the beginning of the guide what's new for the following year. We did a video last year in fall of 2024 talking about what's new for 2025. We're doing it this year, and we will probably do a video every year. So stay tuned and come back. So I'm going to go down this list. There's only a couple things: capping what you pay for prescriptions, more drug cost savings, meeting your healthcare needs, and then it ends here. Okay. So starting at the top, the thing that they're also doing is capping what you pay for prescription drugs. Here's a little description, and notice they reference the page. So you can go down to the page and read more details. But I will tell you what this is. For 2026, the most a Medicare recipient will ever pay out of pocket for prescription drug coverage, and that includes Part D and Part C, okay, whether you get your drug coverage through C or D, is $2,100, okay? Assuming the drugs are covered, right? If they're not covered by the formulary list, they don't count towards that $2,100. Now, why is this important? So with the Inflation Reduction Act that was signed by Biden into law, prior to this, the max out of pocket for seniors was unlimited. You know, once you got to the catastrophic level, the drug card, the insurance company paid 95% of the cost of drugs, and you paid 5% unlimited. There was no cap. And we all know how expensive medications are becoming. It's really obnoxious. So they passed this law and they implemented in stages a max out of pocket. So in 2024, it went, prior to this, it was unlimited. It went from unlimited to $8,000 in 2024. In 2025, it went to $2,000. And really that's where it's going to stay, but they're going to index it every year now. So 2026 is $2,100, 2027 might be $2,200. They'll announce it every year, okay? But it's a good thing, right? So the next thing, more drug cost savings to you. And again, you can reference the page. Now, if you go to this page, it will talk about another piece of the Inflation Reduction Act was for the government to start negotiating prescription drugs for seniors, people on Medicare. And what the law did was the government picks 10 drugs and negotiates those. So there are 10 drugs where they've negotiated the cost. I don't have the list. I need to get the list. And when I get the list, I'm going to put it on this video down here. But starting January 1st of 2026 is the first time they're doing this negotiation on these 10 drugs. Every year they will pick 10 more drugs, 10 more drugs, 10 more drugs. Not GLP-1s for weight loss, by the way, because those were not covered for specifically for weight loss. They're covered for other things, right? If you have other health conditions, but we'll try to get a list to you and make it available here. Next item, meeting your healthcare needs. So Medicare now pays for advanced primary care management services, where your doctor is going to coordinate with other specialists to provide care that is needed. And I don't know why this is new. I would have thought that this is covered and this is kind of a duh, but maybe there's a new coding and there's a new price tag attached to it. I have no idea, but this is now covered and you can read about it on page 31. Early detection matters, page 36. By the way, let me show you page 31. When you go down and reference this, one of the things you'll see is in front of, see this little new? So anything that's new is going to have that little button there, okay? And again, they reference it. But the next thing under new on page 2 is early detection on page 36. Watch this. Early detection. What is this? And why is this new? When I go down to page 36, I don't see a new button. Preventative services, colorectal cancer screening, and the list goes on. This is not new. I don't know if they ran out of things that were new and so they just put this up there to highlight it. It's not new. It's always been covered. So FYI. And then the last two items on page 2 under what's new. The first couple of things are new. That one's not. Okay. Help fight fraud, waste, and abuse. This is not new. Medicare has always been fighting this. They have a toll-free number. You can report anything if a provider is billing you for services that you never got, and we've seen this before. Please, please, please report it. There's a huge amount of fraud in the Medicare space, and so that's not new. Last but not least, they're telling you to go digital, right? So Save a Tree, this document is very big and it costs a lot of money to mail. And you can go to Medicare.gov, create an online Medicare account. I advocate for this because I've done a video on this and talks about what you can do with your online account. You can manage your prescription drug coverage. You can take a look at your claims. In the health insurance world, we call it EOBs, but in the Medicare space, they call it MSN, Medicare Summary Notices. Basically, it summarizes whenever they get a claim. This is how much was billed, this is how much we discounted, this is what Medicare paid, this is what you're responsible for. Your summary notices for all the claims. If you're getting billed by a provider and you don't see a corresponding Medicare summary notice on your account, don't pay it. Make sure that that bill goes to Medicare first, provided it was a service that you got. If it wasn't a service, then definitely make sure that you contact Medicare and say, hey, I did not receive this service, right? Because that is very important to do. But the account going digital, you can also sign up for emails. You can also get the electronic version of this handbook. There you go. So instead of having them mail it to you, you can just log in online and they will get it to you. So the very next page, so we're on page 2, this is what's new, right? There's a couple of new things, not that many. We go to the next page. Here is a table of contents and it outlines everything that's covered in this book. So one of the things I always reference, your Medicare options. There's 2 options, and you go to this page, I reference this all the time. You either do the left or the right. You either do original Medicare paired with a standalone Part D drug card and a supplement, or you do Medicare Advantage, and explains what it is, and it explains how you get coverage and when you can start. Page 13 goes over important dates. October 1st is when Medicare plans become available to shop on Medicare plans are Medicare C and Medicare D on Medicare.gov, right? You could take a look at them. It's Medicare marketing. October 15th is the first time you can change your drug coverage, right? October 15th through December 7th. January 1st, any changes that you make during Medicare annual open enrollment go into effect January 1st, and you can find all this information on page 13. And then, of course, Medicare Advantage open enrollment January 1st through March 31st, and it tells you what that is. And page 14 actually says, how do you explore your options? And it references Medicare.gov. You can go there and shop, and 1-800-Medicare. Okay, it's a great resource. So if you have any questions, if you're shopping, if you need help, call 1-800-Medicare. Now, the rest of this is signing up for Medicare. This is, not helpful for people that are already enrolled because, oh, by the way, you're already signed up. Finding out what Medicare covers. This goes through kind of a summary list of everything that's covered. It also lists all the preventative that is covered at 100%, no cost to you, and it doesn't matter which option you are on, original Medicare or Medicare Advantage. It has to cover that at 100%. Now, on a Medicare Advantage, you do have to go to a provider that's in the network to get that 100% coverage, but it is covered at 100%. What is original Medicare? What is Medicare Advantage? What is the supplement? What is Part D? Get help paying your health and drug costs. What is this? There's this thing called LIS, low income subsidy. It's for people that are above Medicaid. They don't qualify for Medicaid, but they're low income, right? They can get assistance, it's a federal program, to pay for things like prescription drug covers. There are income limits, but you can go to that page and find out about it. It references the page here. Find out your Medicare rights, find help and context definitions. And so these are all the things in the guide. Earlier I said there's some things not in the guide. What is not in the guide? Well, this is the 2026, published in September. What's not in the guide? Medicare Part B premiums for 2026, Medicare deductibles, Medicare for A and B are not. And the reason that is because the government at CMS decides this in about November. This book is published in September. We will know in November when they decide, whatever administration is in, that what it's going to be for the following year. And the government usually raises the premium, raises the deductible. I did a video on what to expect for Medicare Part B premiums. You can watch that. And so that won't be in here. We won't see that information. But Medicare You 2026 guide is now available. We hope you found this video helpful. Until next time, this is Kathy Bukowski, the owner of CB Health Insurance.